Upward movement of the scapula is called elevation. Downward movement is called depression. Forward movement around the trunk is called protraction. The opposite movement is retraction. This movement is called upward rotation. The opposite movement is downward rotation. In real life, these movements of the scapula are often combined. Here's the joint with its loose capsule removed and its ligaments intact. Here's the front of the joint in extension, and here's the back of the joint in flexion. The key structure to understand is this remarkable ligament, which not only holds the radial side of the elbow together, but also holds the rotating head of the radius in place against the ulna. There's another, even more impressive structure that supports the arch of the foot: the plantar aponeurosis. The plantar aponeurosis is a massive sheet of tendon-like tissue that runs the whole length of the foot. It starts here on the calcaneus. It fans out as it runs forward. As it approaches the MP joints, the plantar aponeurosis splits into 5 divisions. To look at the inside of the right atrium, we'll remove this part of its wall. Here's the opening of the superior vena cava above and of the inferior vena cava below. Here's the opening of the coronary sinus. This is the part of the atrial wall that's shared with the left atrium, the interatrial septum. This thin oval patch in the septum is the fossa ovale, the remnant of the foramen ovale that connected the two atria in intrauterine life. The kidneys are located high in the posterior abdominal wall, behind the peritoneum. They lie in front of the 11th and 12th ribs. The right kidney is slightly lower than the left one. To see the kidneys and ureters, we look at a dissection in which all the intra-abdominal organs have been removed. The kidneys are here. As we've done in other dissections, we'll remove the lower anterior ribs to get a better view. The kidneys are surrounded by a layer of fat, which we'll remove. Here are the kidneys. Now we'll move on to look at the sphenoid bone. The sphenoid bone is extremely complex. It extends all the way from one side of the skull to the other. The sphenoid bone forms important parts of the underside and outside of the skull, and it forms part of the orbit. The sphenoid bone also forms this large and complicated part of the floor of the cranium. Just above the optic chiasm, the two anterior cerebral arteries are connected to each other by this very short anterior communicating artery, which is part of the arterial circle. The middle cerebral artery, which is the direct continuation of the internal carotid, curves laterally. It enters the lateral cerebral fissure between the frontal and temporal lobes. We'll follow it there shortly. The pale areas on this artery are patches of atheroma.
Here's the apical region in a specimen where almost all the bone has been removed. Here's the helicotrema. Here's the hamulus, with nerve fibers fanning out from it to supply the most distal part of the basilar membrane. The basilar membrane ends here, just short of the end of the cochlear duct, which is here.